our local demand actually, it increased over the months. Like, for example, when we were in lockdown, March and April, our sales were double, triple times what it usually was because of the local demand. And we also had the opportunity to introduce new products such as the hand sanitizer, which we have developed according to WHO guidelines. And we had the opportunity to supply a lot of government and non-governmental organizations and institutions in huge quantities, which wouldn't have been possible if they were importing the hand sanitizer. We also increased our capacities because of the demand. So because of the knock-on effect of March and April, the lockdown period, the demand had increased so much that it forced us to increase the capacities and procure more machinery, do extensions to the factory to accommodate the machinery. You know, we had to increase manpower as well. So definitely we had a lot more opportunity in 2020, being in the essential health sector. Also because of COVID, they were using a lot of the essential medicines that we manufactured, such as vitamin C, zinc sulfate tablets. So that also, we saw an increase in the procurement of those particular medicines. Exports throughout the East African region also increased for us, particularly South Sudan and Burundi. And we were able to supply government organizations as well, which was a big plus sign for us. Local government, we obviously are the largest local supplier in terms of volume. All our supplies were consistent, which obviously the end user was very pleased about. Despite the hurdles we had with logistics, we managed to supply everything on time, and we continue to do so. Our business model will remain the same and has stayed the same, to manufacture high quality and cost-effective medicines, essential medicines for the local and regional markets. I would say like our strategies would change in that we introduce new products such as the hand sanitizer we talked about before, and we have introduced a few more products, you know, in the pipeline, you know, to do with cardiovascular health and anti-malarials. But I think a long-term strategy, it definitely has put into perspective that we need to focus on building capacity to supply at least the local market and ensure that there's consistent supply of essential medicines to government, to the local market, as well as to export markets. So it's given us a jolt to improve our capacities to meet the demands.